Dr. Braces here. Thanks for tuning in. Today we're going to talk about the differences between braces and Invisalign, so to help you make a decision on which one is right for you. The main thing with braces and Invisalign is majority of cases you can do with Invisalign now. Occasionally you get one case that's maybe very complex and it has movements that you can't pull off with Invisalign. But in most cases you have an option to go either way and you can get the same results. The main advantage of braces is they are glued to your teeth. So if you're talking about a teenager that maybe isn't going to be compliant with Invisalign and not wear them, braces is going to be the right thing to do because they're fixed, they're glued on, we know they're gonna work. With Invisalign, you can take these trays on and off. How the Invisalign works is you take a scan of the teeth and then you get a series of these aligners. And depending on your orthodontist, you'll wear each aligner maybe for 7 to 14 days. Aligner 1 is going to move your teeth just a little bit. Then you go to number 2 and it moves them a little bit more. And so by the time we get to the final tray, you're gonna be looking pretty good. But for these to work, you have to wear them. And if you don't wear them, they're not going to work. The goal is about 20 to 22 hours every day with Invisalign. So with braces, it's a little bit less of a compliance factor, whereas with Invisalign, the responsibility is more on the patient. So that's the number one thing to keep in mind. If you don't think you'll be consistent in wearing these trays, if you think you'll have them out too much, then braces is definitely a better option for you. When I do a consult and I'm talking about Invisalign or braces, the main advantage, in my opinion, to Invisalign, it's kind of a disadvantage that we discussed, is that you could take them off, but it's also an advantage that you could take them off because it's much easier to brush and floss and keep your teeth clean. You don't have all this hardware in the way that you have to get around in order to floss and in order to keep your teeth clean. So with Invisalign, one major advantage is much easier to brush, floss, keep the teeth clean. Another major advantage is obviously they're more cosmetic, right? So they don't show up as much as braces do. So when you wear these aligners, you cannot eat or drink anything except for water. And like we said earlier, you've got to wear them for about 20 to 22 hours every day for them to be effective. If you're a growing teen, for example, and you're constantly eating all the time, Invisalign is going to be pretty challenging because every time that you eat or drink anything other than water, trays have to come off. And that's what one of the biggest challenges is, especially for those that drink a lot of coffee, a lot of soda, tea, that kind of thing. Sometimes Invisalign can be challenging, but for the most part, it's not too bad. I call it the Invisalign diet. When I had Invisalign, I'm a snacker. I mean, I eat, honestly, throughout the day, I am always eating. And so when I had the Invisalign, I kind of broke that habit because it was like, I could have this snack, but that would require me to take out my trays, eat the snack, rinse out my teeth, and then put it back in. And when it's all said and done, in my mind, I was like, you know what? I'm just gonna forego the snack. And so that was a good thing for me. It was good for my diet, good for my health. But that is one of the challenging things, is you can't eat or drink anything but water. With the braces, you've got more food restrictions. So you have to avoid all hard foods. You have to avoid all sticky foods, anything that's doughy, like a bagel, pizza crust, you have to tear out of your mouth. You have to slice up your apples, all those kind of things. So with braces, you've got to be a lot more careful for sure, as far as keeping them on the teeth and preventing them from breaking and coming loose. I've had both. I've had braces, I've had Invisalign. For me, the Invisalign was definitely less painful. I felt like it was just an easier overall treatment for me. That's not the case for everyone. I feel like the braces at first initially give you a little bit more pain. I feel like the initial few days with braces is very, compared to Invisalign, it's pretty significant. It depends on the kind of bracket that you use. I use a Damon bracket, which tends to be one of the more comfortable brackets on the market. So I don't get a lot of complaints from patients about the comfort of braces versus Invisalign in my office. Now that could change depending on the type of brace that the orthodontist uses. Whereas with Invisalign, you're also gonna have some initial soreness onset, but it's much more subtle. The difference for me with Invisalign is when I had the Invisalign, every time I changed a tray, you get just a little sore maybe for a half a day. But since those trays are changing constantly, the best way I could describe it is if I'm talking, if I'm eating, if I'm doing normal day-to-day things, I don't have a lot of discomfort. But if I take my finger and I push hard on my tooth, then I could be like, okay, I can tell I'm a little bit sore. But just like I said, normal day-to-day things, for me at least, I didn't experience a lot of discomfort and soreness. Treatment time. So if it's a simple case, as in, the best way I can describe it is you've had braces in the past, you weren't very good about wearing your retainers, and now the teeth have moved a little bit and you want to get them straight again. Invisalign will actually go faster than the braces in those kind of cases. If it's a normal case, average person coming in for treatment, I feel like they're about time-wise about the same, in my hands at least. And then if it's a very complex case, I feel like the braces are faster than the Invisalign. The speech quality, for example, with braces, back here, you don't have anything that's covering the teeth. And so the speech tends to not change at all with braces. Whereas with Invisalign, you have this thin piece of plastic right here that's covering the teeth. And so at first, when you get your Invisalign, you'll have a little bit of a lisp. And that's totally normal. It usually goes away within a couple weeks. It becomes very subtle where you may still notice it, but the people around you won't, even someone as close as your spouse. The main thing when you're just making this decision is talk to your orthodontist. They will let you know what's going to be the best in your specific case. And if you have an advantage, one is better than the other, they'll let you know. If you're kind of like most patients where you could go either way and be fine, they'll let you know that as well. But it's going to be important to talk to the orthodontist first to make sure Invisalign is an option for you. If you have questions, leave them in the comments. And if you want to know how to choose the right orthodontist for you, click here.